How do uterine septums affect female fertility? Have you ever wondered how a uterine septum might influence a woman's ability to conceive? A uterine septum is a congenital condition where a fibrous or muscular tissue divides the uterine cavity either partially or completely. This condition can have significant implications for female fertility, particularly regarding pregnancy outcomes. Research indicates that a uterine septum is associated with poor reproductive outcomes. Women with this condition may face a higher risk of spontaneous miscarriage, preterm birth, and complications during delivery. These issues arise mainly due to the structural abnormalities of the septum, which can affect blood supply and the overall environment for a developing embryo. The tissue of the septum often has reduced blood flow and altered muscular structure, which can hinder implantation and the embryo's ability to grow properly. When it comes to fertility, the evidence is not as straightforward. Current studies suggest that there is insufficient evidence to directly link a septate uterus with infertility, meaning many women with a uterine septum can conceive without difficulty. However, once pregnancy occurs, the septum can lead to repeated pregnancy losses or complications. For women who have experienced recurrent miscarriages or infertility of unknown cause, surgical treatment known as hysteroscopic metroplasty may be beneficial. This minimally invasive procedure involves removing the septum and has been shown to improve pregnancy outcomes. After surgery, many women report higher pregnancy rates and lower miscarriage rates, with some studies indicating success rates of around 40 to 65%. It is also important to note that while uterine septum and endometriosis are distinct conditions, both can contribute to fertility challenges. Endometriosis affects fertility through inflammation and pelvic adhesions, while a septate uterus primarily impacts implantation and maintaining a pregnancy. Women dealing with both conditions may face compounded difficulties, highlighting the need for thorough evaluation and management by fertility specialists. In summary, a uterine septum is linked to increased risks of miscarriage and adverse pregnancy outcomes. However, there is no strong evidence suggesting that it causes infertility in the traditional sense. Surgical correction can improve pregnancy success rates for those experiencing recurrent losses. Women with a septate uterus can still have normal pregnancies but may require closer monitoring. The abnormal tissue and reduced blood supply associated with the septum likely impair embryo implantation and development. Each woman's experience is unique, so consulting with a healthcare professional for personalized advice is essential.